Good morning, everyone. It's time for Ask the Doctor, and joining me this morning is Dr. Brianne Tarakidas, here to still talk a little bit about breast cancer and breast cancer research. And today our topic is going to be radiation therapy. So how is radiation used with other measures to kind of treat breast cancer?
Sure, thanks for having me. Radiation is a high-energy X-ray beam. It's like a CT scan or a chest X-ray, but it's a more powerful beam. And radiation therapy is typically performed after surgery and then after chemotherapy if a woman needs chemotherapy. And so the role of radiation therapy is to try to prevent the cancer from coming back in the breast if the breast remains, or along the chest wall if a woman has had a mastectomy. And we also know that radiation therapy increases a woman's chance of surviving from breast cancer.
Okay, so not all breast cancer patients necessarily have to have a radiation. So what kind of separates the people that do and the people that don't?
So one of the major separating points is what type of surgery a woman has. So if they have a lumpectomy is where the breast remains but just the cancer is taken out of the breast. If they have a lumpectomy, then radiation therapy is almost always indicated.
Okay.
There are a few special situations in women who are over the age of 70 who have early stage breast cancers, very favorable breast cancers. We don't always use radiation in those women. But otherwise, after a lumpectomy, radiation therapy, they kind of go hand in hand. After a mastectomy, a woman doesn't always need radiation.
Okay.
If it's an early stage breast cancer and a woman has a mastectomy, they won't need radiation. If it's a more advanced breast cancer, if there are lymph nodes involved, things that are a little bit more concerning to us, we would consider radiation after a mastectomy.
Okay, and so then what exactly do patients experience when they feel the radiation? Is it painful? What are they going through?
It's just like a chest X-ray or a CT scan, so there's really no pain. You don't experience much. There are side effects that can be associated with treatment, but the treatment itself is painless.
Okay, well, thank you so much for joining me, doctor, and
Absolutely.
we'll be right back with more news.